What I'm going to do now is ask our speakers to hold Rachel's 5 questions that I've put down, and to respond to those with a set of questions from people here or people online. So I'm going to ask you to ask questions if you have any, and we'll put those together with a response to our discussant. Okay, we've got two questions here. There's a microphone, if you could use it, please, because then our online listeners can hear you.
After you, Angela.
Thank you. I'd really like to thank you all so much for doing this work and putting on this panel discussion today, because quite clearly it's really timely and, as somebody said, impelling. Strangely, my question is almost Rachel's last one. It was forming in my head all the way through your discussions, particularly through Nicola's points and her final points and this terrible thing about Busan you've just raised. I should have said I'm Angela Penrose, and I represent a group of UK-based international NGOs that have been working on social protection for some time. And my question is linked to Rachel's in the sense that over the last 5+ years, we've been working with partners in many countries, particularly in Africa. And it's just this issue of prioritisation. Because one is so keen to say that it's the partners and the government that should be making the policy and not UK-based INGOs, we have been very reticent about pushing any particular type of transfer or social protection measure and talking about a general range of approaches. And I think even UNICEF, surprisingly, has been quite reticent in some areas and not pushing. And I just come back to your question, Rachel. When the ministries of children and women are so weak, when probably most of the local INGOs are quite small, when the term social protection means very little to most of them, doesn't it mean there has to be a much louder, more consensus in the international community to push some of these measures rather than standing back and being too reticent and too academic about it?
Second question here.
I'm Coy Thompson from Children in Crisis. I'm delighted to see there's a book called Children in Crisis being published. I'm just trying to figure out how to make use of the brand potential of that, but that's another issue. It's been very, very provocative, actually, this discussion. I think it is very timely. One of my reflections, which I'd welcome the panel's feedback on, is the present crisis, financial crisis, and the fear of the double-dip recession opening space for promoting the social protection concerns we've been concerned about for the past decade, or is it actually pushing it backwards? Because we've been struggling for a long time to take the cash transfer and the social protection debate away from the safety net idea. And this idea of a social floor, or a social minimum, is really to redirect people's attention to the fact that poor people's lives are about vulnerability, and the small vulnerabilities, not the big shocks, which of course are important, but the small vulnerabilities of everyday life, particularly for people at different stages in their life cycle, such as children, in particular old people, where the social floor makes sense. And we're trying to struggle against the arguments about targeting and against saying, well, these cash transfers are only for times when there's climate change, when there's financial shock and everything else like that. So I'm a little bit I'm really wondering, actually, is the political space opening for the social minimum arguments we've been struggling for, or does it threaten a swing back to the way social protection used to be seen? That's one thing. And it was also the kind of plain puzzle, actually, if there's a recession, there's less cash around, and the fiscal space has shrunk incredibly. And are we being a little bit naive to think, with our sophisticated arguments about different ways to expand the fiscal space, it's going to happen? So it's really a reflection, really. Is there hope for people promoting social protection now, or are there risks that it's going to shift back to an unreconstructed agenda?
Okay, I could take one more question. No, could you just shut the door there, because it's... Okay, so I'm going to go back to our panel whilst you think of... I'll take one more round of questions after this. So we'll go back to the panel, and I'll ask Ariel to start, then go to Isabel to respond, and then Nicola and Rachel, if you want to make any comments as well. And please respond to Rachel's points at the same time.
Yeah. So a few thoughts. First, I think Rachel, her first point was about preparedness, and I think we all struggle with the point. What do we mean by preparedness? What does it take? And I would argue that there's a few things. While it can be a very complex concept, there's a few basics that I think need to be there. One is data, and this can be as sophisticated as you want or as simple as you want, but unless there is some tracking of who is being in a situation of risk, and that data is readily available, the case for responses becomes much weaker. So data, what we call core programs. It's very hard to start improvising. You can scale up programs, but it's very hard to start improvising and creating new programs, even agreeing on what kind of programs need to exist and on a short notice. So having a set of core programs that may be very small but are in place that then can be scaled up, I think is essential. Third is tools. I already mentioned the idea of a system to identify beneficiaries, a system to transfer money, a system to hire more workers if you need to, etc. And then the final obvious one is financing. I actually think that when the other three are in place, it's much easier to deal with the problem of financing. So that's on preparedness. The issue was also raised in terms of negative consequences of social protection responses. I think this goes beyond the crisis. I think there is a crisis aspect to this, which is when you start fiddling around with programs in order to make them responsive to the crisis, and then you actually make them less appropriate after the crisis. And I think some of the issues, and we sort of hint at that in our article, some of the changes in the cash transfer programs raise questions on that. Okay, if you increase the amount of a payment, will you then be able to reduce it after the crisis or not? Okay, and what are the consequences of that? But more generally, I think the important point beyond the crisis is that we do know that social protection programs do affect behaviors, and you do wanna you don't want to overreact to this, but you do want to keep in mind what are the effects you mentioned within the household, but also in the labor market. And I think there's a whole literature on this, and a lot of disagreements on how large the effects are, but it's something to keep in mind. Trade-offs in spending. This has been brought up in various ways. The tension between sort of assistance type of funding for very straight safety net work versus growth enhancing work, and then the tension between supporting different groups. I'm very conscious of these trade-offs, but I sometimes fear that they become more an excuse for not doing things than anything else. The good news is that safety nets are not terribly expensive. They're not massive in cost, even in low-income countries, if done well. And in country after country, there are, without getting into fancy discussions, there are lots of programs that are actually areas in which governments are overspending, we're talking the other day about Egypt. Egypt spends 9% of GDP on untargeted general subsidies. Okay, that with that you can create several safety nets. So I think the tension between we can overdo the argument on trade-offs in spending. I do think that in times of crisis, you probably need to give up on some. I would be willing to give up on some long-term investments in order to cover the needs. Now, which brings me to the final point about the political case for social protection. I have seen, again, I repeat what I said earlier, the change between the late 90s and the late 2000s has been, in this regard, has been massive. And I think that something has happened in the process. I personally think the CCT revolution was quite important in the sense of making clear that even fiscally responsible and even conservative governments, to put it in some way, in a clear way, were able to take the case of Mexico, expand or create large redistributive programs that work. I think that was extremely powerful. I've seen the change in my own institution in that regard. And I think there is the other side of the coin is that it is important to think politically about these things. It's not just about what's the political case in terms of the social benefits of establishing social protection programs, but also what are the political benefits of those programs. And this is where the issue of social cohesion becomes important, conflict, and the role that safety nets play in that regard. I think we've learned quite a bit about that, and I've seen it in action in many regions. But at the same time, it requires not a purely technocratic, if you want, approach, but actually a mixture of good analysis with good communications and good political analysis to understand how to get these things through.
Okay, thank you very much, Ariel. Isabel, can we ask you to make some comments? There were a couple of comments specifically on UNICEF or UNICEF strategy, and maybe some of the other presentations also asked some questions about interagency connections on this issue, but please comment as you like.
Thank you very much. Let me start by saying that putting things in perspective a bit, this crisis comes on top of a huge human crisis that was already existing before. In 2008, when this recession or crisis starts, half of the world was living below the $2 a day poverty line. So this is not about having some measures to try to navigate the crisis and go back to normal, because normal was unacceptable and was really detrimental to children's rights all over the world. So we need to think puts in this type of things of perspective. In terms of responses, what the studies we have done at UNICEF show is that actually during the first phase of the crisis, during 2008-2009, about 25% of all the fiscal stimulus plans were spent on social protection measures, understood very loosely, from social protection, cash transfers to kind of support for social services, vouchers, a variety of measures. So from that perspective, actually the crisis was good to bring the policy message that social protection was very important to for populations, and this here the presentation of Ariel was very relevant, explaining how many measures were introduced in different countries. The problem we face now, and we're very concerned in UNICEF, is that from 2010 onwards, where we have, we enter a period in which fiscal consolidation or fiscal adjustment is seen as a policy priority. And then what we are seeing is that many countries are considering a series of measures that are really undermining progress towards the expansion of social protection and social services that was necessary to cover this previous human crisis, was there before the crisis. And as Richard described, you can check in our publications, many countries are currently contracting or capping wage bills. That includes the wage bill of teachers, nurses, and other social sector workers that are essential for child well-being. They are reducing, eliminating subsidies, including food subsidies, and they are keeping social protection system, but very often they are targeting them to the very minimum. So these, excess targeting up to a point, does have major implications. They are also reforming pension systems, and they're increasing consumption taxes. So going back to the discussion of fiscal space, which I think it is a very, very important one. I think we should keep in mind that social sectors have always had, lesser financing in many countries, and generally have a kind of second-class stigma. So we should think that we need to address this human crisis that has come as a result of the crisis, but it was there before. And we have many arguments to keep thinking on sources of fiscal space. And actually, in a recent study that we have done in 182 countries, we have shown that actually there are many avenues to expand fiscal space, even in the poorest countries. And one of the key things is perhaps not looking at the social expenditures and try to see how to prioritize, reallocate there only, but you can do improvements. But actually, outside of social expenditures, you could actually expand the pot and have it bigger. So you could actually continue expanding much necessary social investments. And just to be very quick, we have examined that there are about 6 ways to find more fiscal space for social protection and social investments, of which the first one is try to reallocate from other expenditures. And here, one has to look to this type of current expenditures that have, limited, public, benefits, let's say, and we have been analyzing military spending, for instance, all around the world. And many countries actually is larger than health spending. So the arguments here to transfer some of that to social expenditures is high. A good thing of the crisis, it has been a kind of push to increase, tax revenues. Even the IMF now is very strongly suggesting that, which is a good move. Now we have to move, and that will be a second big avenue of where to find more fiscal space. Now here the thing is to move a bit from the idea of the VAT and consumption taxes, because they tend to be regressive. The poor pay the same tax for a bag of rice or for some bread than the rich. However, the impact on the income is much larger. And there are many other taxes that can be considered, from corporate profits, financial activities, personal income, property, imports of exports, and just to give an example, Mongolia, for instance, has financed a child benefit from a tax on copper exports. And, so this is a good example. This is a very, very low income country, very good example to follow. Other avenues is try to better use foreign exchange reserves and fiscal reserves. At the moment, there is this trend of many countries are accumulating reserves in the central banks, and we can actually question that policy and think how to use that better for social development. Issues of debt, partially why this fiscal consolidation is happening is a pressure, to come up in terms to debt. Well, countries can restructure existing debt or think on other terms, and this has happened very recently, and that will provide a lot of space to maintain much necessary human investments, and other avenues will include fighting illicit financial flows that are large. I mean, last week we just had a discussion on social protection in El Salvador. And El Salvador at the moment is 5% of GDP is going in illicit financial flows. So if there was some fight of that, you could get much more resources for human development, and then having a more accommodating macroeconomic framework, as we were mentioning, in terms of fiscal deficits or inflation. The pace in which fiscal deficits have to reduce can be expanded, can be done in other ways. So there are many avenues for further investments in social protection and human development, even in the poorest countries. Thank you.
Thank you very much, Isabel. I'm going to ask Nicola if she wants to respond, and also there were a couple of questions about how pushy should we be, and also whether the crisis is opening space versus in relation to social protection, or in fact closing it down.
Okay. I think we should be very pushy. I guess that was really highlighted to me last week. I really thought we had started making the case that child poverty was much more mainstreamed into development agendas. I think the CCT revolution has done a lot to do that, but then to see the Poussin document, it was really a wake-up call to me to think, okay, we need to keep our voices loud, and I think to just be much more coordinated. I mean, I always sort of make this comparison, but I think the gender equality movement or civil society organizations tend to be much more effective at keeping gender issues on the agenda, I think. And I think it's because as a civil society they are very coordinated compared to people working on child rights issues in general. So that's something I think for us to keep thinking about longer term. In terms of having a louder voice, I mean, we just did some work looking at social protection in Nigeria as a response to the crisis there, looking back at what had happened since 2007. And I was looking at particularly how the social protection mechanisms there had addressed child protection vulnerabilities. And just one statistic stood out. I mean, the Ministry there of Social Development, they had only funding to provide support to 800 children. This is out of, a country of 130, 140 million, and with, documented evidence that there are at least 18 million children who qualify, in terms of extreme poor, extremely vulnerable. But, the funding was that small when it came to addressing child protection vulnerabilities. So yes, we need a much, much louder voice. I mean, it's woefully, woefully inadequate. And I think that's why we're trying to sort of highlight this point about let's get the social vulnerabilities further up the agenda and think about creative ways that they can be merged with programs that are much more politically acceptable at the moment. But I think in regard to that, what we really need to look at is perhaps to see what's been happening with the very successful and sophisticated CCT programs of Brazil and Chile and to some extent Colombia, that they're not just CCTs in isolation, they're part of a much broader social protection system, which do have various types of complementary programs that are institutionally linked. And I think what we need to start doing is research into seeing which complementarities are most effective and why. So what's the relative weighting of those? We keep talking about the importance of complementary linkages, but we don't really know what's making the difference and what the interaction effects are. And so I think that's a big research agenda we need to pursue. And then we can start thinking about, okay, yes, it's a different income context, but what are the lessons we can then take to, West or Central Africa, for instance. In terms of Rachel's point about the informal versus informal safety nets, I think it's a really important point, and we tried to look at it a bit in some work we did in the Congo, again with UNICEF. But one of the things that does come up, I think, is that often informal safety nets is not only but partially shorthand for women's unpaid time. And so I think we need to be a little bit careful that when we sort of say, if we then move back to removing some of the formal provision, are we then overlooking all of that sort of overburdening? And I think I would recommend you all read the article drawing on Jodie Heyman's broader body of work in the DPR, which sort of highlights some of the very inadequate levels of care that are happening because of reliance on informal mechanisms. I mean, the accident rate amongst children who are left, young children who are left without adult or qualified adult care is quite horrific in some countries, and I think that article really highlights that very well. So, I think at least amongst some stakeholders I've talked to in Africa or Asia, sometimes it does tend to be a romanticization of the informal mechanisms as well, but I agree we need to look at potential for synergies there. And just one last point on sort of data and making the political case. And another piece of work we're doing at the moment, we've been looking at cash transfers as a way to promote maternal mortality, and I'm reviewing best practice evidence internationally. We realize that programs like Brazil's Bolsa Familia, they do have pre- and postnatal care as a conditionality, and so does Mexico, has some maternal health-related provisions. But the evaluation evidence on that is very limited compared to that which there is on basic child education and health indicators. And I think it just really highlights some of the sort of the points about the politics of data and what we prioritize. So instead of moving forward, I think, yes, we need to have better evidence, but we also need to have better advocacy around the data, or better use of the data that exists, and make sure we're actually addressing the politics that is preventing some of these points from being heard more widely.
Thank you. Rachel, do you want to make any concluding points?
I guess the only one I make is in relation to Coy's point about the social flaw, because we haven't really, nobody's addressed it, not that I'm going to know the answer, but I see the World Bank social protection strategy that's kind of been death by consultation, but I have seen it, and we've all commented on it. We've seen UNICEF's coming out with its new strategy. The EC, the only communique they're putting out next year is on social protection from a list, which is all very fantastic, but I see very little mention of the social flaw explicitly. And given there's been so much effort put into it, I would have expected to see a lot more coming out on it at this point, given that, fiscal space is declining. So my worry is the same as yours, and I think it's yet to see. But I don't know, maybe it's the ILO isn't making a big enough point at the moment. Maybe there's a few actors that need to step up if that's going to really find its legs. I don't know what other people think.
Could I add something to that? We just distributed UNICEF framework for consultations, and actually it is based on the floor. So we're very much supporting that idea, and thank you, Rachel, for bringing it up. Also, let me just tell you that last week I was in Washington and in discussions with the IMF, where actually they are up to a point taking the concept of the floor as well. And this is a very powerful concept because of the idea that it's a level below nobody should fall. So it is being heard and it's moving on. So I wouldn't have such a kind of pessimistic, perhaps, view. I think it's moving ahead.
I wonder though if it's maybe different sides of the Atlantic, because here I would expect to see many European players stepping up right now to make it more visible or make more of a big show. But maybe I just am not in the right spaces at this point. But I think if you're right, UNICEF is definitely doing it, because we talked about that with Jenny Jablonski when she was over last week. But I would just expect to see more European players talking more about it, actually.
Okay. Well, we're out of time. I'm not going to take another round of questions. I do think it's been an extraordinary rich discussion, so I really do want to thank all the participants. Certainly there's been a lot about nuancing what we understand at the micro level. I think Coy asked, are we being naive in a time of crisis, asking for attention to these vulnerabilities? And I don't think we are, actually. I think we do need to be more pushy and bring our voice up. At the beginning of this piece of research, we had a conference with UNICEF 3 years ago, and there was a very interesting presentation from Thai Social Development Department, who, during the crisis in '97, had cut back hugely on their social expenditures. And then when they were confronted with the crisis in 2008, they, as part of their fiscal stimulus program, invested a large amount of money on maintaining social expenditures, or in fact investing more in some areas of social expenditures, having learned of the effects, the longer term effects of the crisis on social vulnerabilities. And I think that wasn't naive. So I think that choices can be made. So I do urge you to please read our development policy review. And there is, as I said, a 30-day free trial access. If you're online, you'll get an email about that. And also we have this Children in Crisis book coming out, which many of the articles in there are from the work that we've been doing over the last 3 years with UNICEF and with AIM. So it remains for me to thank Isabel and Richard for getting up so early, and indeed Ariel, who is also getting up very early because he came from Washington last night. So we thank them very much for attending, and also to Nicola and Rachel, who didn't have to get up so early, but nevertheless made very good contributions. Thank you both very much indeed. And please do follow up with us at any time you want. We're all working on this issue. So thank you all very much for attending.